one of the parts of the project that we're working on with the Complex Spine Project is an inventory that a complex care provider could go through with the family and much more detail, walking through the things to consider. And part of that was, in creating that, we added a section on checking in with palliative care, and where, if the family was receiving palliative care, if they had experience with the palliative care service at the hospital, and if that was something that they might find helpful in the process.
Yeah, I think my own experience with learning about palliative care probably reflects the place that lots of families are. I think if you go out on the street and ask a family, talk to me about what palliative care is, well, that's what great Aunt Gertrude got in her last weeks when she was dying of cancer. They came in and they gave her lots of morphine and helped her die peacefully. And I think that's the public perception of palliative care. And obviously there's much, much more to it, and it is incredibly helpful for complex patients. So my understanding of palliative care has come a long way in the last few years, and I think that it behooves us to try to explain to families that no, this doesn't mean we're giving up on your patient, and your child is terminal, and we're going to go home and give them morphine. It behooves us to explain to them what's available, because I don't think most people know or understand that.
Mm-hmm. Absolutely.
Totally agree. And these discussions about palliative care type things of health trajectory and quality of life and hopes and concerns and all of that, they take time. And in the existing healthcare system is just not set up, I think, to allow those conversations to really evolve, right? I mean, it's so hard to sit down and let's talk about that in our 15-minute outpatient clinic visit. It's just, you can't get anywhere. So I think a lot of times palliative care is a specialty, especially when they're equipped to be ubiquitous, and to even think about these types of conversations outside of traditional healthcare encounters, home visit, conversations with the family, multidisciplinary team meetings like that. I think that's what has to occur a lot of times in order to enable these conversations to happen. And, a 2 or 3 hour conversation about this is not unreasonable to think about, to really get into it and try to arrive at the end of that in a place where everyone feels comfortable about what we're talking about and how to use that information to figure out how to proceed with surgery or not.
And also, when you think about the bigger picture, it could actually be an initiation for a family to better understand what palliative care is, to know what the services are at the hospital, but also it was a pathway for us to get hooked up with community-based palliative care services, via the hospital team. So that was incredibly helpful, that, an avenue and a resource that continues to help us today, that I think that unfortunately families find out so much further down the road than they could.
Well, I have to say one thing that I think that palliative care does extremely well, which is challenging, I think, in this perioperative space, especially for new providers sort of coming in to meet a family for the first time. So let's say Dr. Emans says, I've got this patient, complex medical needs. We're considering spinal fusion surgery. I'd love for you to sit down with them to talk about things. And I'm meeting them for the first time. It's really hard to jump into so let's talk about your child's survival. And what do you think about that over the next couple of years? I mean, that's such a heavy topic to broach. I feel like the palliative care clinicians are so fantastic at building rapport, and they know how to have these conversations so much better than I do. And that can really lead to things opening up pretty quickly. And that rapport, I think, is unbelievably important for families as they're going throughout this process.